right, morning everybody. Welcome back. We have Aiesha here, and we are back in the Maryland office with Natural Transplants. Aiesha, welcome.
Hi, thank you.
You're excited?
Yes, I am.
Awesome. So today we have another traction case. Tell us a little bit about kind of what's been going on, what brings you to us, and how you found us.
Okay, so I was on YouTube. Actually, I was on Pinterest, and they were talking about I saw natural transplants when I was looking for like hair transplant procedures. And then I just started going through the pictures, and I saw a lot of women of color, and so that was more reassuring. And I was looking into this for a while, so I came in for a consultation.
Good.
And here I am, trying to restore my edges back to its glory.
Awesome. If you don't mind just pulling your hair back just so we can kind of see the extent of it. And usually, what we talked about before, that we usually tell patients we can cover about 2 fingers distance without an issue, and that should cover that without any problem. Oftentimes we can get to 3 fingers if we need to. We also have a little bit of loss behind the ears that we're going to try to replace as well today, and that's that way on both sides. So, great. We're going to do a little bit of drawing, a little bit of shaving, and then we'll get back to you before we go back to the other room. Sound good? All right. Appreciate you doing this for everybody. Thank you. All right. We'll see you in a little bit. We are back with Aiesha, and took a little bit, but we got what we wanted to. So you can zoom in. We're going to show you kind of our priority zones here, and again, we should be able to get the first 2 fingers all the way around without an issue. I did not shave yet the back here, just in case we can't get to that area. I think we'll be okay, but just to be on the safe side, I'm going to keep the hair there. Once the strip's out, we kind of get a sense of how much we have. Then I'll go ahead and shave behind the ears, assuming we get enough. All right. We just took a half a Valium. How do you feel?
I feel great.
Doing okay? All right, so we're going to head to the other room, get started, and then we'll check in with you towards the end of the procedure.
Okay.
Sound good? All right, cool. Awesome. All right, we are back with Aiesha. We made it. It was a long day, but we did it. How do you feel?
I feel good.
Doing okay?
I'm excited about my new hairline.
Excellent. How overall? How was the day? How was the process? Better than you thought? Worse than you thought? About the same?
It was pretty good.
Yeah.
I enjoyed the
Injections were a little rough, which is not unusual. Yeah.
Yes.
We got you through it.
Yes, we got through it.
Yeah.
With the help of good medications.
Right.
It was a good experience overall. It was very pleasant. The staff's wonderful.
Awesome.
And I'm looking forward to my hairline.
Good. So, excellent. The hard part oftentimes is the waiting. So, 3 to 4 months, like we said before, it even starts, a year for the final results.
Yeah.
Okay, but I'm looking forward to it. I'm just going to have him pan in just so you can see here. We were able to get, the front row or 2 of the real small 1 and 2 hair grafts. Behind that is the larger grafts. We were able to get back behind the ears on both sides. We had a little bit of oozing from the incision, so we just have a wrap around you. That you can take off tomorrow. And then otherwise I'd show off the incision, but it looks good.
Okay.
So any words of advice, anybody? They're wondering whether to do it or not?
Well, go for it.
Go for it.
It'll be worth it in the long run. Patience pays off.
Cool.
Resiliency, all that.
Well, we do appreciate you doing this for everybody, and hopefully somebody will see it and you'll kind of influence other people. It's awesome. And hopefully we'll check in with you as the months go on and the year goes on, and we'll see the new you in about a year from now.
Okay, sounds good.
Appreciate it. All right, take care.
Call us now, 844-327-4247, and ask about our Hue and Hue Plus procedures, which move more hair than ever before. Hope to hear from you soon.